The real message I want parents to take away from this conversation and from our story is really to always trust their gut and listen to their intuition. Nobody knows your child better than you do.
Hello everyone, and welcome to Visionary Voices in Optometry, a video series where we aim to raise awareness about eye health through personal stories and expert conversations. I'm Mark Donison, CEO of the Ontario Association of Optometrists, and today I'm joined by Kaitlyn Winterink and Dr. Fanny Szutu. Kaitlyn and Dr. Fanny are here to share Kaitlyn's family's journey with retinoblastoma, a rare but serious eye cancer that affects young children, and how one eye exam changed everything. Kaitlyn, thank you so much for being here with us today. It's an incredibly brave moment for you to be here and to share your family's story. And we're looking forward to hearing what you have to share with us today. So thank you very much. We know absolutely will help other parents as well. So it's a very important topic, right? And so,
thank you.
Thanks. Let's start off by asking if you could take us back to the very beginning. So how did all of this journey start?
Sure. So I first noticed an issue with my son's eye when he was about 5 months old. And it wasn't something I had noticed from him before. I basically woke up one morning and his right eye looked a little bit off center to me. It looked like it wasn't properly aligned with his left eye. And it was very, very subtle at first from what I could tell. I kind of brought that forward to my friends and family, and nobody really saw what I was seeing. I did bring him to see our family doctor, who also couldn't really see the same issue that I had noticed. To be fair, at the time, it wasn't something that would happen on a consistent basis. My family doctor was going to be referring us to a pediatrician at our local hospital for an unrelated issue. So he tacked this onto the referral just to bring forth my concern. And when we saw that pediatrician, they did see that his eye was wandering. At this time, it had gotten a little bit worse. And we were referred onward to a pediatric ophthalmologist. During this time, we had about a 4 to 6 month waiting period to see the pediatric ophthalmologist in person. So I just basically started calling any optometrists in my area that would see pediatric patients. I was extremely lucky that Dr. Szutu's office got back to me very quickly, and they booked me an appointment within 2 to 3 days of me calling. And we brought in my son Nash to Dr. Szutu's office on November 25th of 2021. And Dr. Szutu took a look in his eyes, and she noticed a mass in his right eye. And that was really where our journey with retinoblastoma began.
So what was going through your mind as a mom when you were first starting to sense that something was going on?
I was very worried. It was very stressful. I was a first-time mom. My son had already faced some other very minor health challenges, but I felt like I didn't have any options. I really wanted to take him to see a specialist. And while we were waiting for the pediatric ophthalmology referral, I was feeling really frustrated. And it really showed me that I had taken for granted how easy it was to access an optometrist in my area. It was something that would never be an issue to get an appointment, and to get an appointment quickly, until I wasn't able to get one. And I was just finding it to be really stressful and worrisome that I could see the deterioration in my son's condition. And although I had no reason to believe that there was anything more going on than the strabismus that I was told about, I still knew that my son needed some specialized care. So it was a pretty frustrating time for me.
And some angst
yes,
there, as you're not
much
knowing what was going on.
Very
right?
much so.
Yeah, right.
Yeah.
Dr. Szutu, thank you very much for joining us as well. Wonderful for you to be here. Could you start by telling us a little bit about yourself and your work as an optometrist?
Well, I graduated from the University of Waterloo School of Optometry in 2010. So I've been practicing for about 15 years. I currently practice in Bowmanville, which is just a little bit east of here. It's a great community, a lot of young families, so we actually see a ton of kids in our practice every day.
And what had you go into optometry?
Well, my story is very similar to a lot of my colleagues. I needed glasses at a young age, but my parents weren't aware because they both had great vision. It wasn't until my grade 4 teacher mentioned that I couldn't see and wasn't focusing in class. I can still remember the first time I put on my first pair of glasses and suddenly being able to see all the detail around me. By high school, I was pretty sure I wanted to be an optometrist. I was seeing my own optometrist quite regularly, and I saw the impact she had on other people's lives, on my life, And I wanted to do something meaningful too that would have a positive impact on other people's lives.
And we're here to talk a little bit more about that as well today too. So thank you for that. Let's talk a little bit more about the Kaitlyn story and the journey that we're talking about specifically here. So what made you think or sense that there was something going on during Nash's exam?
Well, when Kaitlyn came in, she already mentioned that Nash's eye was turning in and it wasn't present at birth. And Nash was actually a very calm 7-month-old baby. I was able to get a quick look in his eyes right away, and I saw an abnormally large mass in his right eye.
So you have a 7-month-old child with you in the exam room. Could you walk us through the eye exam that you performed on Nash and how they led to the diagnosis?
Well, initially, I was checking to see if he was able to track the objects in front of him. I checked to see if he reacted to light. I did a quick prescription check to see if he was very farsighted or nearsighted. And then I took a quick look inside his eyes. After that, we did a dilation to get a better view. And after the dilation, I was pretty certain he had retinoblastoma.
And so just how rare is retinoblastoma?
It is a very rare type of cancer found in children under the age of 2. Globally, I believe the number is 1 in 18,000 children can develop retinoblastoma. It's definitely one of those conditions where a lot of my colleagues and myself have only seen it in textbooks and not in real life practice.
And how difficult is it to detect in an infant's eye?
It's very difficult because a parent cannot see the tumor when they're just looking at the baby's eyes. And a baby can't verbally communicate to the parents that they're not seeing well out of the affected eye. The most common way to detect it is with a white pupil or a whitish glow that you see in pictures taken with flash. Normally we see the red eye effect when we take photos. But with retinoblastoma, we're actually catching a glimpse of that white tumor with photos. But parents may not understand that a white pupil means something abnormal or think anything of it.
Mm-hmm. So let's explore that a little bit more then. So what role does an optometrist play when it comes to retinoblastoma?
Oh, we play a very important role because a lot of times we're actually the first person to take a look into the baby's eyes and perform the necessary tests that can screen for conditions like this. As optometrists, we're in a unique position as healthcare providers where we're doing more than just checking the vision or prescribing glasses. We play a part in the first line defense for the child's overall health and well-being. Nash's story is a perfect example of that.
Thank you for that. That's it's so critical, isn't it, to have experts like Fanny here with us today. So let's come back to you then, Kaitlyn. Sure. So since it's been a few years now, tell us how is Nash doing, and what about his follow-up care? So what does that look like today?
Sure. So Nash is doing amazing now. He is the most strong, brave, resilient child you could ever meet. And if you had no idea what he had been through, you would never be able to tell what his story, how complicated his story has been and what he's had to endure. Nash is been in remission from retinoblastoma since May of 2022. He did require a couple different types of chemotherapy to get us to that point, but we're extremely grateful that he responded well to those. And there is a genetic component to retinoblastoma. Nash has a genetic variant that we don't entirely know what it means in terms of the cause of the retinoblastoma that he has. And unfortunately, his baby brother has the same one. So right now, Nash and his baby brother, Cole, go to Sick Kids every 3 months for eye exams. And in terms of things we do at home for him, he still does patching therapy. So he wears an eye patch on his unaffected eye to strengthen his affected eye for about 2 hours every day. And that helps with his eye turn and also to keep the strength in that eye and just retain as much vision as we can possibly get. He does have better vision looking downward than he does looking upward. So we just want to keep that strong and make sure that his brain still remembers to use that eye. And he wears glasses. And other than that, he's just such an amazing little boy. And we're so grateful.
Proud parent.
Yes, very proud.
Totally, it's fantastic.
Very proud.
It's Fanny, back over to you. So what kind of follow-up care is involved after a diagnosis like Nash had?
After the diagnosis, the appropriate referral needs to be made as soon as possible. so that he can see the right specialist. Time is of the essence here because the sooner the treatment, the better the outcome.
Right. And in general, what red flags, because you mentioned it a little bit before, so in general, what red flags should parents be looking for in children, and when should they bring them to an optometrist for an eye exam?
There are many red flags, which includes excessive blinking, excessive squinting, red or painful itchy eyes, misalignment of the eyes, closing one eye to focus. But a lot of the times you have to keep in mind the child may appear fine and display no obvious symptoms. Early screening can detect for issues long before some of these symptoms even appear. So for a younger child, they may not be able to even communicate to the parents that something is wrong. And an older child may assume what they're seeing is normal when in fact it's not. So the best recommendation here is every child needs to be seen by the age of 6 months. And if everything checks out fine, they should still be seen every year after the age of 2.
So, Kaitlyn, the story that you're sharing with us is obviously full of different elements, right? And so there's some positives, there's some really tough times as well. And so, what could you share with us, sort of how this has changed your life and how it's changed how you look at life?
It's changed our life in many ways. November 25th of 2021, when we saw Dr. Szutu in her office, was the worst day of my life, the most stressful day. It was the hardest time, and I could not see normalcy, and I could not see the light at the end of the tunnel of this diagnosis. And now I know that although retinoblastoma is rare, we're not the only ones that struggle with this. We have a great community of people around us. We try and stay involved with the retinoblastoma community. We attend retinoblastoma conferences now to share Nash's story. And we attend retinoblastoma family picnics to stay connected with kids that are just like my son and have him know that he's not alone as well. And it showed me that there's always somebody that has it worse than we have. We are so grateful that retinoblastoma is treatable, and his tumor was found by Dr. Szutu earlier than most kids have their tumor diagnosed. He was diagnosed with a grade C tumor, and if we had had to wait until we saw the pediatric ophthalmologist, we might have had a very different outcome. His tumor was very close to his optic nerve at the time of diagnosis, which is basically a portal for the cancer to leave the eye. And retinoblastoma is very difficult to treat once it does leave the eye, and that would be a very scary situation for us. So because we were able to get such a timely diagnosis, undoubtedly we were able to save more of his vision. We were able to save his eye, which is pretty incredible. And it possibly prevented the cancer from spreading. So we are extremely thankful to Dr. Szutu.
Many times people will think of a doctor, right, an optometrist, and go, oh, they're a doctor, right? And so how has this experience changed your relation and how you see optometry and the connection that you have now with Dr. Szutu?
Well, I can never thank her enough. And when we met our Sick Kids team, which Dr. Szutu connected us with, the day of Nash's appointment, she sent us directly to Sick Kids Emergency, and we were connected with the retinoblastoma team the following day. So in terms of her getting us in to see the correct people as quickly as she did, seeing us as quickly as she did when others said no, we could not ever thank her enough. And once we spoke to Nash's ophthalmology team at Sick Kids, they explained to us how rare retinoblastoma really is and how lucky we are that we had a specialist that was able to catch something as rare as it was and get us on the right track for treatment. And from the day that we saw Dr. Szutu for the first time to the day we started chemotherapy was 6 days. And we know that the speed in which we were able to get the ball rolling, get the diagnosis, get the proper imaging, and get a treatment plan in place was critical to his positive outcome.
Wow, so powerful. So, geez. Fanny, you mentioned earlier on that you got into optometry because you wanted to make a difference. How did this instance land with you, right? So how do you feel now after a few years of seeing Nash's progress and the treatment that he's undergone?
So this experience has really reminded me of why I got into optometry and do what I do each day. And it makes me want to remind every parent that I see to make sure their child is getting checked regularly and by 6 months of age.
So if there's one message you hope parents take away from this conversation, what would it be?
The real message I want parents to take away from this conversation and from our story is really to always trust their gut and listen to their intuition. Nobody knows your child better than you do. And especially when you have very young children, to touch on what Dr. Fanny said as well, they cannot communicate everything that they experience, everything they see, and everything they feel. And you really have to act as an advocate for them because nobody else is going to do it for you. And the other message I want parents to know is that I always assumed if there was a real serious problem with my son's eye, that I would have seen that glowing white pupil. And that's something that I actually never saw because I did not realize that modern phone cameras automatically suppress the red reflex in the eye. And now from meeting our retinoblastoma team, I know that you can recreate the red reflex on a cell phone by forcing the flash in a dark room in video mode. And once we did that, my son's eye glowed like the moon. So I love to share that message with parents because it's something so easy that anyone can do at home with their average cell phone. If there's something specific that they're concerned about, that would show them something that would warrant further investigation.
Awesome, thank you. And how about you?
If there's anything to take away from this, is that an eye exam can save a child's sight or even their life. Every parent should be booking that eye exam for their child at 6 months. You don't need a referral to see an optometrist. And kids should be getting their eyes checked every year regularly because it supports their healthy development, their learning, and we want to address any issues before it impacts their daily life and their future.
So before we wrap up, thank you so much to both of you. It's a wonderful story and really appreciate you sharing your experiences. It's so wonderful to hear that Nash is coming along quite nicely. Yes. So that's terrific. Before we wrap up, were there any other words or thoughts that you wanted to share with our listeners today?
I just wanted to reiterate what Dr. Szutu said about the importance of eye exams, especially in babies and very young children, because to be honest, if I had not noticed an issue that was visible with my son's eyes, it would not have been on my radar to get my son an eye exam as an infant. It was not something I had seen my friends do, and it was not something discussed with us at the hospital when we left with a newborn baby to really express how important it was. And now I know, like Dr. Szutu said, it really can save your child's life to get an eye exam at an early age. You should never feel silly or feel like you're overreacting or like you're wasting anybody's time by booking that appointment, especially if you feel like there's something wrong.
Excellent. Very powerful, strong message for everybody to listen to. You need to get your eyes checked.
Yeah.
Okay, perfect. Thanks so much. It was wonderful. Really appreciate it. And all the best to you and your family.
Thank you very much.
And thank you so much for making such a difference in people's lives. Thanks for being with us today. Stories like Nash's remind us just how powerful early detection can be and how important it is to trust your instincts as a parent. If you notice something unusual in your child's eyes, even something small, get it checked. No concern is ever too small when it comes to your child's vision or their life. And to Kaitlyn and Dr. Szutu, thank you so much for being here with us. Your honesty and expertise will help another family catch something early. That's the impact of awareness, and that's the impact of getting your eyes checked regularly. Take care, and we'll see you next time.